I'm Brittany Green. I'm going to be doing a head, eyes, ears, nose, and throat assessment. This is Jessica. She is over 18 and she has consented to letting me do an assessment. First of all, I'm just going to check the overall texture and condition of the skin. The forearm's a good place to look. I'll just check the turgor. She's got nice elastic skin turgor, which is a good sign of hydration. If it was loose, that might be that they're dehydrated. You know, if it was tight, it could be because they're swollen. I'll also go ahead and check her fingernails while I'm here. And her fingernails, her nail beds look nice and pink. I just kind of press with my fingernail on the nail bed to check for capillary refill. You want it to be nice and brisk, which hers is, which is a good sign for circulation. She's got good circulation. If the cap refill was kind of sluggish, it could mean that, you know, she's got poor circulation, maybe some cold hands. Jessica, have you had any itching or rashes or anything going on with your skin out of the norm?
No.
No? Important to ask your patient, you know, what they can tell you about their skin, you know. Always important to listen to your patient. Next, I'm going to check Jessica's scalp. I'm just going to kind of check the condition of her hair. It's clean and healthy. You know, nothing there. Just kind of check her scalp. You know, make sure there's no hives or dry skin, flaking, lesions, anything like that. And her scalp looks good and healthy. Next, I'm also, you know, going to keep in mind looking for just overall, you know, appearance of the skin. You know, does she have, you know, lesions or rashes or, you know, anything on her skin? And hers looks good and healthy. So next I'm going to check her eyes. I'm going to assess her pupils. I just want to see that they are equal in size, that they're both round, that they react to light. So I have my little pen light here, or if I had an ophthalmoscope, I would use that. Just gonna check her pupil there, and it reacted nice and briskly, both of them, the same size, so that's what we want. You know, if there was any variance, if they were different sizes or they don't react briskly to the light, you know, you want to note that. If it's a change, make the physician aware if, you know, you're at the bedside. Next, I'm going to use this as the otoscope. Since I don't have one, but if I did, the otoscope I could use to look more, you know, deeper into the nasal passages and into the ear and throat and things. It would allow a more focused point of light through there. So I could just kind of check up the nasal passages, make sure they're nice and clear and there's no lesions or anything going on there. Jessica, can I have you open your mouth and stick out your tongue? You can look in her throat, make sure there's no redness or swelling. Can you raise your tongue? Check under the tongue, make sure there's no masses or lesions or anything going on there. Check the condition of the teeth, make sure they're intact and they're not broken or missing. Also want to check the ear. Just check the external structure of the ear, make sure everything, you know, looks nice and normal. You know, I would look with the otoscope down the ear canal and note the structures there, make sure everything looks nice and normal. I'll also want to check, feel around the face and the head, you know, for the sinuses. Make sure when I'm pushing, let me know if you feel any tenderness. You know, feel and see if she's having any tenderness, any issues, any tenderness to your neck or any of the places I'm pushing behind the ears. Okay.